If you've ever wondered why diabetes affects the eyes, how to prevent it, how to protect your vision, or what signs you need to look out for, this video is for you. Today, we are answering questions. These are some of the questions patients ask about diabetic eye disease, also known as diabetic retinopathy. Now, that's a smart question. When your blood sugar stays high for a long time, it can damage the tiny blood vessels all over your body, especially the ones in your eyes. Inside your eyes, there is a light sensitive area which we call the retina. It's basically like the screen of your eyes. That's the part that helps you to see clearly. High blood sugar can make these blood vessels around the retina weak or leaky. That is, it means it begins to leak. That damage is what we call diabetic retinopathy. If it gets worse, it can lead to vision problems or even blindness. That's why regular eye checks are so important if you have that, even if you think your vision is okay. Again, think of your retina like the camera lens of your eyes. It's the one that helps you to actually see. So when the small vessels there are damaged by diabetes, they can leak, swell, or bleed. There are two main stages. There is the stage 1, which is the non-proliferative retinopathy. That's the early stage, where the blood vessels becomes weak and they begin to leak. There is a proliferative stage, or the proliferative retinopathy, where new fragile blood vessels begin to grow and bleed into the eyes. So if that is untreated, it can also cause vision loss or even blindness. How you will know that you have diabetic retinopathy is quite a tricky one, because you might not notice any change at first. It usually develops silently. That's why we recommend a yearly eye screening for people living with diabetes. It can detect problems early for you, and even before your vision is significantly affected, you will be able to know. However, if you notice changes in your vision, don't ignore them. There are some signs you can look out for, and I'll be mentioning those signs now. One is if you notice your vision is becoming blurred, you need to begin to look out for something. If you notice that you are seeing small spots or floating shapes when you move around, that's a thing. You're having trouble to see at night, that's something. Or you are just not able to see suddenly. Your eyes begins to you just go blind suddenly. Of course, that's a serious case, and that's something you need to work on. Now, if any of this happen, please get your eyes checked right away. The earlier we catch it, the better we can to protect your sight. How can you protect your eyes from diabetes? Good question again. So you have more power than you actually think. And here is how. If you can ensure that you need to keep your blood sugar within the range that it should be. Control your blood pressure and the cholesterol level. These three things are always connected together. And of course, attend your annual eye screening. Of course, don't smoke. Get help early if your vision changes. These are some simple ways you can change this. You can reverse this situation. It is always better for you to catch it, and that keeps your chances higher if it is caught early. Remember that. Is it treatable? Well, yes, depending on how advanced it is. The treatment options are quite a number of them, but one of them is laser therapy. That's the one that stops the leaking blood vessels from leaking, right? There are also other injections that can be injected into the eyes to reduce the swelling because of the bleeding in it. Sometimes also a surgery can be done, to remove all of the leakages and the swelling. If you live with diabetes, I want to reassure you and remind you that your eyes matter. Don't wait until you notice a problem actually. Book your eye screening section, manage your blood sugar, protect your sight. And I want to believe that you would have a better and a more fruitful and productive life. Thank you again for watching. Until I see you in the next episode, please subscribe to this channel and share this video with anyone you feel will benefit.